So now we're going to go into the actual surgery part. We're going to start off by giving our surgeon the towel. And then we have to gown and glove our surgeons. And you can just throw that on the patient's feet. Okay. So when we're gowning our surgeons, we want to cup the arms. We want to make sure none of our hand is showing. Oops, sorry. And then I'm going to tie her up real quick. Normally you would not do this. You will just get her gloves ready. So when you're gowning and gloving the surgeon, you want to make sure and pull their hands out just a little bit, or they'll do it themselves, either way. And then you open the right hand. Oh,
That's okay.
And normally they won't rip, hopefully. If they do, then they're contaminated. And so now your surgeon is ready to go, and then we will turn. Oh, that one. And then we will start draping. Now we're going to switch it up a little bit, and Tammy's going to be the surg tech, and I'm going to be the surgeon. So I'm going to come over and stay on that side. You're going to towel out the surgical site. And then the 4 towel clips. Yes, please. You can hand them off to me, okay? The surgeon will usually be the one that does this. And if you want to grab that drape. And when we are up here doing this for the lab final, I kind of help you a little bit, because especially with this class, we haven't been able to go over everything as well. There's a picture of a person here, so the head will align with the head. So we're just going to stick this part down here. And then when you're draping, you just let it fall. Make sure your hands don't fall below the table, and then come up from this end up here. Bring your hand up here.
Oh, up here. I'm sorry.
It's okay. This drape is kind of different, so we'll just let that go.
Oh, it is kind of different.
Yeah. And then the next thing that we're going to do as a scrub tech, you are going to bring your table around. Since we just kind of threw Tammy into this to help out today. There we go. And then normally we have light covers. Ours don't work for our new lights, so we're not going to mess with those. And then we get all of this stuff and we kind of just put it up here, and then we'll start passing that stuff off as well. This does not have, hold on one second. So we have our non-penetrating towel clip. We're just going to clip this on here, and then all of this stuff, the suction tubing, we're going to have up here as well. We'll attach the suction tip to the tubing. Go hold that so I don't drop that off of it. And then we will attach these to the drape so that those don't come off. And then that can go right back there. And then we're ready to start. So we're going to first put 2 sponges up on the field, 1 on each side. And then I'm going to start just asking you for all of the instruments. So let's get a blade first, even though we have a giant open incision here already. Let me get a wheat lantern, which is still on the back table for this one. There we go. All right, let me get the DeBakey's and the suture scissors. There's already some sutures in this. Nope, that's straight.
Oh, I'm here. Yeah.
Yep.
I'm sorry.
That's okay.
Let me start.
There we go. We're going to take out these old sutures for this one. When you guys do your lab finals, hopefully we won't have them quite like this. And then this one, it looks like they've already we actually cut the let me get it like a Richardson. Or actually no, your Army Navy's will work. Up here.
Oh, I was like, where are they at?
Yeah, we've already fixed this one. So we're gonna have you hold that right there. And then let me think. We're gonna just kind of suture the actual sack back closed since I didn't do that last time. So I'll let you let go of this one. And then I need let me get the silk stitch. So no, like, oh, this one, yeah. And then your needle holders are up here.
Oh, okay.
You know. Hopefully I can do this. So we're gonna try to. Okay. And then if you will hold on to these, I will have you cut here in a little bit. That is not gonna work there, I'd hoped. Let me get the rat tooth on the back, the big one. It's this one over on this side, yeah, over to the right.
Oh.
Yep. So I'm gonna use the rat tooth because it has better purchase on the needle, and then it slides off. Okay, seriously. Okay, and then you'll cut. And we'll throw one more stitch in there. Somehow. Maybe. Okay. And cut. And then I'm going to give you the needle back. Let me get a hemostat. And then we'll just pretend that we're doing something fun in here. This is the section of the test where basically what I'm doing is making sure that you guys can pass and know what your instruments are. So, Babcock. And then let's do Metzenbaums. And we'll cut this little piece of vein off here. And we're going to say that this is your specimen. So if you want to grab, let's just use that bowl, that big bowl. So then we passed off a little tiny portion of specimen. All right, let's see what else. Alice. Let's see, everything looks good in there. So let's get some irrigation. The bulb. Just the bulb syringe. Okay, and then if you'll get the suction tip ready. So what you'll do is you'll put the suction tip in there, and since we're going to throw this one away, I'm just going to actually do it. Normally I don't actually put the suction or the fluids in there because this is all cloth and it makes a huge moldy mess. It happens in real life too, don't worry. So we've sectioned all that out. Perfect. And then let me give that back to you so I don't make a mess. And then let's Bovie, which seems really weird since the Bovie's right here on my side, but they really do that. So there's a little bleeder here, so we're just going to buzz it, bzz, and it's all Bovied and beautiful now. Let me get a tie on a pass. Okay, and oh, well, we're just going to try to do it this way. We're going to tie off this little section here because it wasn't tied off before, so that's probably why the patient is back, is that has been bleeding for at least a year.
Well, mercy.
Go ahead, you can get that. So now the patient will stop bleeding to death, hopefully. All right, so now we've got everything kind of closed up in there. Everything is looking good. So let's do a closing stitch. Let's use that Ethibond right there. This catheter bag, like, right in my leg. I'm gonna have to use that one. And then make sure when you're loading these, make sure that they stay over the sterile field. And then pick up. Let's do the advocacy. So since I'm closing the first layer, what they would do is your partner is going to be your circulator. Someone that's in there with you will be your circulator, and they're going to start the closing count, which for this, in a normal circumstance, it's just going to be like your socks, but since we're doing a lab final, it's going to be your instruments. So I'm going to do the instrument count with her because William is very busy videotaping and can't do that. So we are going to start with your instruments. Let's do towel clips.
Oh, you don't want paper?
No.
Okay.
So we have 4 on the field, and I will always help you out with that and tell you that there are 4 on the field. So there's 4 on the field. And there should be 2. Okay. Non-penetrating towel clips.
1, 2.
Mosquitoes.
1, 2, 3, 4.
Okay. And then hemostats. I made a huge mess on her Mayo stand, so.
Yeah, because I see the ones. I see 1. It is easier if you set it up yourself.
It is much easier when you set it up yourself.
Because I am not seeing. Okay, 1, 2.
There should be 2 more.
Oh yes, 1, 2, 3, 4.
Okay. Straight Mayos?
You have 1 on the field.
No, I don't have any Mayos up here. Straight, I'm sorry. Straight hemostats.
Oh, okay. I was like, okay.
My bad.
Okay, so 1, 2, 3, 4, 4.
Nope. There should just be 2. And then 2 cokers.
You were exactly right. 1, 2, and then 2 cokers.
2 cokers, okay. Babcock's,
I've got that. One,
Alice's,
two, three. I have four. Let's see. One, two, three, four. Okay, I have four.
right angles.
One, two.
No. So we're
Right
gonna,
angle, I have one, two, three, four, four.
and then there's that, yep, that's it, that's 5.
Okay, 5.
Needle holders, working,
One. One in the field. 2.
okay? And then count all of your scissors together.
1, 2. 1 on the field. So 3, 4, 5. I have 5 scissors altogether.
Alright, and then count all of your pickups all together. And make sure you start at the field.
Start at the field.
Yeah, when we're doing our counts, sorry, I
One on the
forgot to
field.
mention that. When we do our counts, we start at the field, then the mayo, then the back
I
table.
forgot about that. 1 on the field. 2, 3, 4, 5, 6, 7, 8. I have 8.
Retractors, count them all together.
Okay. I have 1 on the field. And I have
Up here.
2, 3, 4, 5, 6. I have 6.
Is that including the ride line?
Yes.
Okay, alright. Section tips, all of them together. We have the one Jonkerwood tip and
On
then,
the field, and then 1 Fraser tip in the stylet. 2. So it's 2 together.
okay. Oh, knife handles?
Oh yes. I have.
Yeah, there's that one up there.
Oh, you didn't use. Okay.
Yeah.
1 on the field, and then 2, 3 knife handles.
And then needle back there. Alright, so that's all of your instruments. So then Bovie,
1 Bobby.
when you do
On
the
field.
Bovie count, they wanna see, the circulator wants to see it. So 1 Bovie, marker,
I have 1, 2, 3, 4.
boat,
I have 1 boat.
reel,
Right here. Oh, 1 reel.
Ratex. So you start at the field.
Yes. 1, 2 on the field. 3, 4, 5, 6, 7, 8. I'm missing 2.
Okay, hold on. So we got 1, 2,
1, 2.
and then 3, 4, 5, 6, 7.
8, 9.
So you're missing 1 because I dropped it on the floor.
Okay, so I have 10.
So 10.
So we're accounted for. Okay.
Laps.
Okay, laps we have 1, 2, 3, 4, 5.
And then Kittners.
Kittners we have 1 on the field, then 2, 3, 4, 5.
Injectables.
Injectables we have 1.
And then I hid that one
Okay,
2.
2,
And then
and then 3.
Asepto.
1, 2.
Needles.
Needles we have. What do we have? 1, 2, and then still count these anyway.
3.
Okay, so 3.
And then blades.
1,
And then there's this other one.
2. Okay, 2 blades.
Scratch pad. We have 1 on the field.
And 1 over here, so 2.
Oh, so 2. Okay. All right. So the counts are good. So now I'm going to start my closing. We've already irrigated. So I'm going to make her do that again. So let's have the monocryl stitch, please.
Stay over, stay up.
And then let me have an Adson with teeth. Okay. Oh, I had one. Yeah.
That's okay, I'll give it back to you.
And then can I also get a mosquito? Where the end of this is, I can't see it. There. Alright, so now what they would do with the circulator and what we'll do in the lab final is we will start the final count, which is just the soft count. You don't have to count instruments. It's just the stuff that's on the board up there. So let's count. Let's start with Bovie.
1, 2, 2.
Bovie tip is 1. Markers.
1, 2, 3, 4 pieces.
Okay. Boat.
1 boat.
Reel.
1 reel.
Latex.
Latex. We have 1 dropped.
So you'll just have to count these, and then I'll count the dropped one.
Okay. So 1, 2 on the field. 3, 4, 5, 6, 7, 8, 9.
And then 1 on the field makes 10.
Okay.
Laps.
Laps. We have 1, 2, 3, 4, 5.
Okay. Pitners.
Kittners. We have 1 on the field and 1, 2, 3, 4, 5.
Okay. Injectables.
Injectables. We have 2.
We have that weird one.
Oh, that one. Okay, so we have 3 actually.
Okay. Asepto.
Asepto, we have 2 pieces.
Okay. Oh. Needles.
Needle, we
I have 1 working.
have 1 on the field. 2, 3.
Okay. Blades.
I have 1 on the nail and 1 here, so I have 2.
Okay. And scratch pad.
I have 2.
All right. So the counts are good. So what you're going to start doing at this point is on your Mayo stand, or on the back table, you'll start putting up everything that we didn't use. Leave your Mayo stand kind of how it is. And then for the instruments, the string instruments, you'll just line those up the best you can. And then afterwards, I'll go through and we'll fix that set. You have to go with size 7 gloves.
Yeah, mine are too big too, and I usually use these.
So I'm gaining weight everywhere but one. So all of the lab finals will be a little different because I don't have a script I go off of. We just kind of go based on how I see it's going. If I see that you're struggling with passing instruments, then I'm going to have you pass a whole bunch of them in a row. If I see that you don't know your instruments, then I'm going to start calling for all sorts of instruments over and over again. So basically what I'm looking for is whatever you seem to be struggling with the most, that's what I'm going to work on. That way we can get you the practice you need, even though it's during your lab final. We get you the practice that you need before you go in and actually do all of this on a patient. We talked the other day in lab, I think it was in the Wednesday lab, we talked about what sutures. I will always ask you for the sutures that I want. I don't expect you to know what the sutures I need are. Surgeons usually don't either. And when I'm doing my closing stitch, I try to do a sub-Q because it takes me longer because I haven't had as much practice in recent years. And so that gives you guys the time that you need to kind of clean everything up over there. And get the counts done and all of that stuff. So, this is far from pretty, but we're going to consider this closed. So next what I'm going to do is cut these ends off. I'm going to give Tammy back her last needle. And then I'm going to ask her for a sloppy wet and a sloppy dry. So in the lab, we're not actually going to make them sloppy wet, but what you'll do in the OR is get them really wet. You don't wring them out. You just get them wet, and then they'll wipe off the wound.
Sloppy dry.
And then this, I don't know why we call it sloppy dry, but we do. And then at that point, then we're ready for dressings. So let me grab those real quick.
She's a surgeon and a circulator.
Right. So here are your dressings.
Thank you. They were on my back table this whole time.
So she's gonna hand me her dressing, and then I'm going to place it here. She's gonna put her hand on top of it, and then I'm going to release all of these and throw them up here. So she's gonna keep that hand right there, and then when I go to move this dressing back, she's gonna switch out. And then that's all. So that is pretty much the end of your lab final. However, you will notice on your sheets, it will also tell you that you need to know how to disrobe and clean everything up. So when you're disrobing, you're gonna untie this outer portion, and and then you grab from behind, and you're gonna pull this all off and bundle it up together. That way, if there's anything inside your gown, it stays in the gown. So take off your gloves. You're gonna stick your fingers inside the cuff, pull off about that far, stick your thumb down. That way, everything that was on your gloves is now sealed into those gloves as well, and then those go in the trash also. And then afterwards, then you're gonna help clean up while I finish up the grading. So that takes you all the way from the very beginning to the end of your lab finals.